My name is Majd Tarabichi. I'm an orthopedic surgeon specializing in hip and knee replacement at the Illinois Bone and Joint Institute. I like to think of taking care of patients as joint decision-making. I see it as me presenting the options of what I think are reasonable treatments for a patient based on the severity of their hip or knee arthritis and degree of disability or pain, and then coming up with a plan that's agreed by myself and the patient. I like to take a graduated approach to things, starting with nonoperative treatment. Classically, we always think of older people needing joint replacement. What we found is that patients with arthritis are getting younger and younger. It's really gratifying to see patients going back to the sports they enjoy, go from a state of sometimes profound pain to completely pain-free and doing all the things that they love to do. The contrast is so stark when you see someone on their first day after surgery and they tell you, "Doctor, my pain is gone," and then seeing them 2-3 months down the line when they've fully recovered, it's really what makes me wake up and go to work every day. One of the big advantages of Illinois Bone and Joint Institute is we have a wide spectrum of providers. Everyone is very subspecialized, so when you're seeing someone, you know that they are doing that particular procedure or operating on that particular area of the body hundreds of times a year. When you're coming to see someone at IBJI, you're really seeing someone who's truly an expert